The role of vitamin D and calcium homeostasis in epilepsy. Epilepsy is a chronic neurological condition characterized by spontaneous seizures. Antiepileptic drugs, AEDs, are the primary treatment for controlling seizures and are effective in about 70% of cases. However, long-term AED use can induce vitamin D and calcium deficiency so profound that these drugs have been linked to increased osteoporosis and fracture risk in children and adults. What is even more concerning is that recent literature links hypocalcemia and vitamin D deficiency to higher seizure frequency in epileptic patients taking AEDs. Paradoxically, anti-seizure medications taken to reduce seizure frequency may have the opposite effect in cases where vitamin D and serum calcium are very low. Here's what naturopathic doctors need to keep in mind when treating epileptic patients.
Calcium homeostasis in epilepsy. Multiple abnormalities of bone metabolism are present in patients taking AEDs long-term. These include hypocalcemia, hypophosphatemia, reduced serum levels of biologically active vitamin D metabolites, and hypoparathyroidism. Clinical studies have shown that more than 50% of adults on AEDs have decreased bone density of either the spine or the hip. Mechanism of action. AEDs that are CYP450 inducers can cause increased conversion of bioavailable vitamin D to its inactive metabolites. Over time, this can lead to a vitamin D deficiency, which leads to decreased absorption of calcium in the gut, resulting in hypocalcemia. AEDs may also directly interfere with intestinal absorption of calcium. The body's compensatory mechanism recruits parathyroid hormone as an attempt to maintain adequate calcium levels in the serum. This calcium is taken from the bone. But when calcium stores near depletion, serum levels can no longer be maintained and the permeability of neuronal membranes to sodium increases. The possibility of generating spontaneous action potentials rises, potentially leading to seizure induction.
Vitamin D supplementation in epileptic patients on AEDs. In a cross-sectional study, vitamin D deficiency was found to be highly prevalent among children treated with AEDs for epilepsy in pediatric neurology clinic. Only 25% of children had levels considered normal. In a randomized control study, 2 different doses of vitamin D were given to 72 adults and 78 children on long-term AED therapy to assess its impact on bone health. High-dose vitamin D resulted in increased bone density at several skeletal sites in adults. Low-dose vitamin D was sufficient to produce similar results in children. In a third study, correction of vitamin D deficiency in 13 patients with pharmacoresistant epilepsy had an anticonvulsant effect, reducing seizure frequency by 40%. To conclude, reversing vitamin D and calcium deficiencies in this population has positive outcomes on bone density, but supplementation may also significantly decrease seizure activity.
Let's look at a documented case study. A 5-month-old healthy infant presented to the emergency department in springtime with generalized seizures. On admission, he was found to have severe vitamin D deficiency, hypocalcemia, and iron deficiency. There were no clinical signs of rickets, but the wrist x-ray revealed evidence of rickets. The baby made a full recovery after treatment with calcium, magnesium, vitamin D, and iron. Learning from this case. It can be difficult to achieve adequate vitamin D levels without supplementation depending on the geographic location. Serum vitamin D levels tend to be lower at the end of winter. Breast milk contains negligible concentrations of vitamin D and breastfed infants are at a risk of deficiency. Afebrile seizures were the most common clinical presentation in infants with severe hypocalcemia, secondary to vitamin D deficiency at 2 hospitals in North London. If recurring, afebrile seizures become labeled as epilepsy. This further supports the clinical observation that vitamin D deficiency and hypocalcemia are linked to increased seizure activity.
Okay team, here's what we learned. Healthcare providers should monitor calcium and vitamin D levels in all epileptic patients on AED therapy. Epileptic patients who may be more vulnerable to vitamin D deficiency and hypocalcemia have multi-drug therapy, poor diet, reduced exposure to sunlight, and reduced physical activity. Children are especially vulnerable, perhaps due to having a smaller calcium buffer from bone compared to adults. Prophylactic supplementation with vitamin D and calcium is necessary in patients undergoing long-term AED treatment to increase bone mineral density and reduce osteoporosis and fracture risk, and to reduce potential risk of increased seizure frequency.
We recommend supplementing with 2,000 to 4,000 IUs of vitamin D and 1,000 to 1,500 milligrams of calcium daily. Ensure adequate dietary intake of calcium. Ensure patients are exercising against gravity to maintain adequate bone mineral density. And don't forget to get plenty of sunlight.